CA prostate, the treatment. First stage comes the tumor confined to the prostate. That is stage T1, T2, lymph node negative, metastasis negative. Now you can imagine that tumor is confined to prostate, to a small area. And you can imagine that you can remove the prostate completely. That is radical treatment in the form of radical prostatectomy or radical radiotherapy. Next stage comes prostate tumor has come outside the prostate, but not very extensive. That stage comes T3, lymph node positive or metastasis negative. Now the growth of the tumor which is outside the prostate, in that condition you cannot remove the tumor completely. So you need to reduce the size of the tumor by giving the neoadjuvant therapy or adjuvant therapy. Neoadjuvant therapy is given before the surgery. Adjuvant therapy is after the surgery. This adjuvant treatment is given in the form of hormonal treatment or radiotherapy. Along with the adjuvant or neoadjuvant therapy, the radical treatment is given when the adjuvant therapy or neoadjuvant therapy has reduced the size of the tumor so that the radical treatment can cure the remaining part of the tumor. Next stage comes metastatic disease, that is M1. M1 stage, in this tumor is present all over the body. Now you can imagine that when the tumor is in all over the body, you cannot remove the tumor completely. So you cannot give the curative treatment. Now you have to give the palliative treatment. That stands for control of the tumor for some time, not the eradication of the tumor or curative treatment of the tumor with some symptomatic relief. For CA prostate, this palliative treatment is given in the form of hormonal treatment. Why hormonal treatment? Because the CA prostate is dependent on the testosterone to grow. This hormonal treatment is given to cut down the testosterone production. To cut down the testosterone production, you have to remove the testis and you have to control the testosterone or androgen production from the adrenal gland. From the testosterone from the testis, that is removed by the surgical or medical castration. Surgical castration in the form of bilateral orchidectomy, medical castration in the form of gonadotropin releasing hormone, that is goserelin, given subcutaneously in the form of depot monthly, 3 monthly or 6 monthly, depending on the requirement of the patient. Along with the castration, you have to give the androgen receptor blocker to block the androgen production from the adrenal gland, that is bicalutamide. This hormonal treatment is effective only up to 3 years. If you want to increase the duration of effectiveness of the hormonal treatment, you have to give the hormonal treatment intermittently. Intermittent treatment of the hormone is given with the medical castration. It is not possible with the surgical castration, but it is possible with the medical castration. By giving the medical castration intermittently, means you have given 3 monthly goserelin, then next 3 months give the gap, then again you give the goserelin for the next 3 months. It means for 1 year you have given the medical castration for 6 months only. Like this, you can increase the duration of effectiveness of hormonal treatment for more than 3 years. Otherwise, the tumor, carcinoma prostate, converts into the hormone resistant prostate cancer.